Hi, I'm Jane, and this is Tyler, and along with Stuart and Branton, we represent TonsilView, a hands-free jaw prop and tongue depressor. The motivation behind this device comes from peritonsillar abscesses and post-tonsillectomy hemorrhages, which are soft tissue conditions that report to the ER. This affects about 90,000 people in the United States annually and can lead to the spreading of infection and even death if left untreated. Currently, a clinician in the emergency room would use one hand in these procedures to simply depress the tongue and would have to do the entire rest of the procedure with their other hand. This is inefficient, costly, and is not ideal for the patient or the clinician themselves. And this, in fact, results in some patients needing to be taken to the operating room for these relatively simple procedures. Our device gives clinicians the view they need and the support they need by combining three elements: a tongue depressor, a jaw prop, and a cheek guard. Together, these integrate into a device that is simple and easy to use and allows for the clinician to have good access to the back of the throat. TonsilView is a safe, hands-free device that is designed to reduce patient anxiety and pain and quicken treatment in the emergency room.
This quickened treatment is so valuable to a hospital because what we see is that roughly half of all people that have peritonsillar abscesses end up needing to go under general anesthesia rather than just do the quick outpatient procedure. Along with 20,000 tonsillectomy hemorrhages and around 10,000 other diagnostic tests that may involve visualizing the back of the mouth, this creates a need for around 45,000 of these devices per year just in the United States. TonsilView is more than just a fancy tongue depressor. As you can see, here's a fancy tongue depressor that has a light on it, and while that does help with visualization, it still requires the clinician to use one of their hands to depress the tongue. TonsilView is unique in that it allows the clinician to utilize both hands to focus on the procedure and not worry about keeping the patient's tongue down. It also comes at a competitive price of less than $10 per disposable device, and that disposable device aids in this being a device using a quick procedure with quick turnaround time. TonsilView fills that space between the quick, easy treatment and the expensive and complex emergency surgery. It saves time and money by helping avoid these elongated procedures. It helps avoid the labor needed for these procedures, as well as the operating room time and scheduling issues. It also helps prevent any misdiagnoses. It helps prevent the need for CT scans and prevents the need for a lot of emergency room visits for patients in rural areas. It really does help fill this gap between the tongue depressor and a more complex surgery. The exit strategy for TonsilView involves licensing to a company like Medtronic, Integra, or Cook that has an existing hospital catalog. This will allow for easy integration with all of the other medical devices already used in the hospital. Above all, TonsilView is going to help reduce patient pain and anxiety with fast, effective treatment and make an overall pleasant experience for both the patient and the clinician. Thank you.